what you got. Boo, boo, boo. Boo, 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 boo. Boo, 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 boo.
Where is your uniform?
I'm off duty now.
And on display.
Gotta get the meat to market.
This is a stick-up.
Joanne, this is an operation.
Where you been, nurse? We don't wait around here, you know. When we operate, we operate. Scalpels.
Which one, Doctor?
What would you use? Damn it, learn something here. Take a look. What would you use? Come on. Give me a 20. Damn it. You were the doctor, poor kid would be pushing daisies.
It'd be the first fatal shoulder blade in the history of medicine.
Is someone talking? Is someone carrying on a conversation in my operating room? Give me a clamp. You call that a clamp? Use your head. This is a person we're cutting, not a Christmas turkey. Out. Get over here. Jesus.
Getting a really weird reading on him.
Weird. Is that now a medical term? What are you getting, flying saucers?
His respiratory flow volumes dropped from 7 liters to 3.
Nothing to worry about. Kid's had congenital spots on one lung since he was... Well, ever since the first time I saw him, and I was holding him in one hand. Give me a forceps here. No, Oh, you're right, you're right. Don't give me what I asked for. Give me what I need.
Congratulations. It's a shoulder blade. Really? Is he really okay?
Mother and shoulder blade are doing fine.
Oh, good. They're putting him in 314. Thanks a lot, okay?
In 7 minutes, I'll be exploring the gastrointestinal tract of one Miss Imbroglio. Meanwhile, we have this room that old Ed left who departed us last night.
Leaving us?
This invitingly and vacant room and bed.
In 7 minutes. Sorry, Doc.
Hi.
Where's the ocean?
Oh, the ocean's still out there. We had a little accident.
Hey, boy. How's tricks?
Looks like fate pulled one on me, Dad.
They say some babe had to pull you out of the drink, huh?
Excuse me.
Who sent you the flowers? Nobody even knows you've been sick.
I did.
What is that?
Just the babe who pulled him out of the drink.
Dumb. Dumb thing to do. When you don't control your boom, it's going to control you. Now, you screw up like that in that regatta, you're going to have a crew mutiny on your hands. I'm his crew. Well, up and at him, man. I got to go. Business calls, you know. Wait a minute. I almost forgot. Just in case you want to buy yourself a cigar, huh?
Thanks, Dad.
Okay, babe. Take it easy.
He's not much on formalities. Neither am I. Hey, who are you?
Just the babe who pulled you. I'm Kitty.
I'm Matt. Why do hospitals always have to smell like hospital?
Here. How about a breath of ocean breeze number 5?
Hi! How is he? Teddy? Teddy?
Every time a junkie dies, the crime rate goes down.
That kid is not a junkie. I've been treating him for 2 months.
For what?
Conjunctivitis.
My ass.
His eyes.
Yeah.
My job is to take care of people who can't get back to the hospital.
Yeah, well, you got one less patient to worry about.
Hey, lighten up on him.
Hey, lady, the kid's dead.
So just go on and let him die, right?
Part of the job. Nothing in the rule book says I gotta go to the funeral.
Give it up, man.
doing? No exercise. Doctor's orders.
Do you know how many doctors have made that same statement to me?
Turn over and be quiet.
That's enough, thanks.
No, it's not enough. Look, I didn't ask for this job. Hey, I'm lying. I requested this duty. I got jealous when I thought of anybody else doing it.
You mean someone was killed by this stuff?
Yeah.
It's amazing. I'd love a chance at the body. I'd like to run some tests on a guy who died from an injection of vitamin B, B12, E, and niacin.
You mean that's all there was?
Not in the binding agent, whatever that was. It wasn't enough to have killed him.
Then what did?
Check back with me tomorrow. I'll see if the body of your late friend can tell me anything.
Okay.
He's in there throwing needles at that poor old lady like she was a dartboard.
This woman has no veins. It's fantastic. Is that possible?
Nurse Henderson, stab 317. Nurse Henderson, please.
I called the wild. This woman has a vein. You find it.
Dr. Krebs to surgery. Dr. Krebs. Anyone knowing disassembly procedures for a revolving door, report to maintenance.
I'll stay with her a while. Can you run into 328 and give Mr. Farrell his penicillin for me? Remember, just pinch the skin and plunge cleanly.
Pinch the skin and plunge cleanly. Sure.
Why can't they just let me die or go to Philadelphia?
They didn't have one single magazine about boats. Do you believe that?
That's okay. Maybe this old life's got a sports section.
Hey, kid, you're looking good. Looks like you could sail this afternoon. Here's some pictures for you. Wow, look at that view. You can almost see the boat from here.
I think it would be better if we could keep his mind off of boats for a while.
Look it, so the kid's got a little problem. You treat him like an invalid, he's going to become an invalid.
Well, if I'd known how hard you were trying to kill him, I wouldn't have bothered saving him.
He's not trying to kill me.
Kindness kills too, you know.
Which way do you prefer, Matt?
What's with her?
I understand you've been giving medical lessons again?
I needed some help.
When I first came here, my ambition, which I have achieved, was to be head nurse, not head doctor. You would be wise to have a similar ambition in your hostile mind.
I am not hostile. You know there aren't enough doctors here. If I can take care of some of the smaller jobs, it takes the pressure off them for the more important things.
You want to do a doctor's job. You want the candy stripers to do your job. Then who's going to do the candy stripers' job? The cleaning ladies? You get your way, you'll have the patients emptying their own bedpans.
No, I wouldn't. Emptying bedpans is a nurse's job.
The binding agent wasn't a binding agent at all. It was a drug called Quadrin.
Never even heard of it.
The government refused to approve it. It had a couple of problems. First of all, it was an aphrodisiac.
Seems there'd be a market for that.
I'd buy it. Unfortunately, it was a couple of other things, too. Just a tad more than the proper dosage, you started hallucinating. And then by the time you were getting tired of whatever vision you were having, you went into a coma.
Nothing like happy endings for hallucinations.
Oh, it got happier. Up the dosage another zip. It's time to pick your pallbearers. Once they found out what the stuff was, they locked it up.
Well, you can tell them some of it's leaking out.
And Come on, Jeff. Out. Keep right on going, just the way you do it, all the time. Up and down, up and down, up and down. Come on, run, 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 run. Take it easy. Take it easy, Jeff.
Oh, I'm sorry.
How are you?
Let me alone. I'm a nurse. Come on. How do you feel?
I'm okay, Doc. Oh, that's fine, Jeff. That's fine. That's fine. That's fine. That's fine. Now, let's come up. Now, it was very reckless of you. You know that.
I'm sorry.
Are you really all right?
Doctor.
Yes, that's right. I think that's wonderful. You feel me?
Hey, don't you remember me?
No.
Michelle. Michelle
Rhodes.
Right,
Sandy's daughter.
right.
How are you?
I'm fine.
A nurse now. Are you
Right.
You're right now. You come right
I'm really sorry.
Well, well, well. So, and what are you in now? Surgery?
Medicine.
Medicine. Oh, you all right? You all right, Jeff? That's good. Oh, sit down. That's fine. You all right now? Sandy Rhodes' daughter.
Yeah.
I just think, oh, you're all grown up.
Dr. Haskell, have you ever heard of a drug called Quagrin? I'm trying to find out where it comes from. A friend of mine was killed by it.
I'm sorry to hear that. Quagrin? No, never heard of it. You see, I try to use natural herbs instead of drugs. There's so many new names of drugs in the medical monthly. If I run across Quagrin, I'll let you know.
Thank you. I'd appreciate that, Doctor.
Oh, I don't think you're going to notice.
I was thinking of my boyfriend.
Come on, get dressed. Do you really think you're going to get that grant?
If I do you really think you're going to come work for me?
I don't see how I could survive on $50 a week.
You would be surprised how long it takes to starve to death. I've lasted over a year.
I've lasted longer than that, and I don't make any money at all. You should get your boyfriend to pay for everything.
You're not looking at the whole thing.
The thing you don't like is that it's run by a woman.
The thing I don't like is it's unlicensed. It's unusual.
It's a lot more effective than anything you could do, and a hell of a lot cheaper. I don't see her driving one of those fancy Aston Martins.
Look, what do you want me to do? You want me to put cash in my paychecks?
I just want you to start caring about something besides them.
Thee. All good things come to those who wait. Hey, sister, what's happening? How you doing, baby?
Okay. Been working a lot.
There used to be a time when you didn't have to work so much.
It used to be nice until you said, hey, baby, let's go down to the Baja. And you forgot to tell me that piñata you picked up was full of Peruvian cocaine.
Hey, baby, I ain't dealing in nothing now, except for this boatyard here.
Oh, yeah? I was kind of hoping you were still on the streets.
Well, I still hear something every now and then.
Lester, you ever heard of a drug called Quagrin?
No.
I didn't either until today.
Hey, baby, remember that poncho I brought back from La Paz? Well, why don't you go inside and put it on, and I'll take you out somewhere.
Okay. Is it still in the same place?
You know it.
Hey, Lester, no, Come on, get your hands off the bike. Last time you messed with it, you blew out my gearbox. And had me walking for 2 days.
You gonna meet me later or what?
Let's make it tomorrow. I have to, make some runs.
4:30 at the Seaview.
Okay. Bye-bye.
Ciao.
This is an exercise. Sitting is an exercise, and lying in a bed is an exercise.
Well, what exactly are you in training for?
Oh, for life, I guess.
For what?
No, for the regatta, really.
Matt? You can't sail with that shoulder.
Don't tell me I can't.
All right, I won't tell you you can't.
I like people who tell me I can.
Okay, you can.
Ah, a little private duty too, huh, nurse?
Just physical therapy.
A treat instead of a treatment. I'll bet she's pretty good at it too, huh, Matt?
Dad.
Oh, come on. You know me. I'm only kidding you. Life's a ball. You gotta take it and run with it, right? I gotta run too. You take care of yourself.
Oh, God. I bet the night nurses forgot to mark his injection again. The second time in a month. Nancy, get me Dr. Krebs. Quick. What's he doing operating?
He's not going to die or anything.
Laboratory emergency. Yeah, this is Joanne. I got a patient with a double dose of insulin. I need glucagon, 1 cc, stat. Well, I'm ordering it. Dr. Krebs' authorization. The man's in a coma, so get him quick. You go into medicine. Do it as a doctor.
What a time to be a manager of a rock star. In the middle of a song, his voice breaks. I'm paying $85 an hour for this studio. You guys go back in there and play.
What I want to know is, why didn't you just drive him to the hospital?
Because it looks a little more real to take him to the hospital in an ambulance.
Oh, looks terrific in the papers, too.
Right, but this guy can't sing. He can't even hum. He never could hum.
Do you know her blood type? Get her admitted. I'll meet her in surgery with a cross match.
But you know you can't do that.
You worry about her. I'll take care of them. I need 1 unit universal donor type blood. Now.
Unauthorized? Forget it.
That woman does not need 3 copies of a doctor's signature. She needs blood. Now.
And cross-matched. Okay. I'll tell him I had nothing to do with it.
Tell him whatever you want. Tell him I bit you on the neck for it. Just give it to me. Thank you.
Nurses.
The patient will not be admitted to the hospital until we have his full name.
You got his full name. Chicken is his full name. Has 5 million record buys. Chicken is his full name.
His age?
We don't give that out.
Who do you think you are?
I'm his manager. I get 15% of everything he gets, including his pain.
Does he have hospitalization?
How are you going to get insurance on a guy that started 4 riots in 6 weeks? Or 6 riots in 4 weeks? We can't even count.
Then we can't admit him.
What?
We've had too many experiences with people who don't pay their bills. There's no way to repossess an operation, you know.
Look, lady, this guy gets $60,000 a riot. 4 more riots, he could buy the hospital. Now, he doesn't need an operation. He just has a little laryngitis. What's he doing in a wheelchair anyway?
I can have you put into a wheelchair too, Buster.
Thanks, I'll walk. I'm taking him to his room.
Hold it, buddy. I'm taking him to his room.
I have to have a last name on that creature.
Well, if it make you happy, his full name is Chicken Delight.
Aren't you glad I got you out of the hospital?
You better believe it.
Now, isn't this more fun than sailing a boat?
Well, some people like sailing boats and some people like flying kites. Besides, sailing isn't the only thing that gives me pleasure.
Oh, yeah?
Yeah.
What gives you pleasure?
You.
No business calls?
This is business.
Then get down to it. And let's stick to business, shall we?
You're a nurse, right? And you stick to being a nurse. You take care of my boy's body, but you don't fuck with his mind.
I'm not. My job is to help him get well.
Listen, girl.
You listen. It's more important for Matt to get better than to sail in some race just so that you can catch a picture in the paper.
Do you know who you're talking to?
Mm-hmm. A man who's getting older and who's mad because his son is getting more attention.
That kid's gonna live to be 80, but he won't be half as good as I am in any way.
Mr. Fairbanks, I hate to be the one to tell you this, seeing how much you love competition. But this is one race you've already lost.
Oh, you little bitch, I'll show you who's lost. Damn it.
What's wrong?
Yeah.
Did you know?
No. Whatever you want. Michelle. Come here, baby. Come here.
Yes, Marina Del Rey. I need the listing for the Seaview Club.
Quagren? No, never heard of it.
Operator, forget it. Thanks.
Hi, Michelle.
Hi, Kitty.
See what I made for Matt?
Hey, beautiful.
I thought as long as he was going to not be on his boat, this would be the next best thing, you know?
Yeah, listen, I gotta be on duty in a half an hour, but I gotta make a run. Can you cover for me?
Well, sure.
Thanks.
Anything wrong?
No, I just gotta get a prescription filled.
What are you doing dressed?
I'm leaving.
You're what?
I'm not gonna miss that race. My father's checking me out.
But that's dangerous.
I'll survive.
Hey, I brought you.
The hospital more pleasant.
This is not what we mean by pleasant.
It was pleasant, wasn't it?
You do have a tendency to overstep your authority occasionally.
When there are enough doctors, I'll stick to emptying bedpans.
You did order that emergency cross match yesterday. You should have waited.
The patient couldn't wait.
Well, I'm glad you admit it anyway. Shows you're willing to accept the responsibility for your actions. But it's unfortunate that because of what you did, that woman now has septicemia. We'll be lucky, frankly, if she lives. Because if she lives, she'll soup.
Is there anything I can do?
You can stay home for a day or two till I can get the board together for a hearing.
I am sorry.
I'm sorry too, Joanne. For a nurse, you're a hell of a doctor. And you should have waited. We'll be lucky, frankly, if she lives.
Head nurse, not head doctor.
For a nurse, you're a hell of a doctor.
He's not going to die or anything.
You want to do a doctor?
Huh. And that is what I have been paying $25 for. You know, they ought to be arrested doctors. They're bandits, all of them. You're okay, Ken. I'm going to tell my sister about this place. Of course, she lives in Omaha. I'm going to send her a telegram.
Why don't you tell all your friends about this place?
Yeah, I think I'm going to. It's fantastic. Wish I'd known about it earlier. I'd be saving money all these years. Okay. Thanks a lot.
See you later.
Okay.
How are things?
Looking up. How about you?
You wouldn't believe it.
Oh, Miss Whitey?
Yes.
I'm Lucille Enders. From the Times, we talked on the phone.
Oh, yes. This is Joanne Scott, my assistant. Joanne, Miss Enders.
How do you do? No, Mrs. Enders. I prefer Mrs. I'm not ashamed of the fact that I'm married. However, I'll refer to you as Ms., if that's what you'd like.
Your choice. Should we go in the other room?
Oh, okay. To tell you the truth, I got this assignment because I'm female. I'd much rather be writing about fires.
We could burn the place down if that would help.
Well, what I'm after is a little story for the woman's section. Something about your background, a little about your home life.
My favorite recipes.
Oh, this may turn out to be okay after all.
How about all the famous people that visit us here? The fire commissioner, the board of health, the vice squad.
You really are busy.
Oh, we're a regular tourist attraction. We've even been inspected by the restaurant licensed people for using yogurt in our treatment.
Yogurt? About the treatment,
Hey, why don't we have a picture of you learning to examine yourself?
Oh, no. No. I have someone to do that. An actual gynecologist. Why don't you examine your assistant? I'm sure she wouldn't object.
Oh, no, not at all. We do have other functions here besides training women to find infection.
I'll bet you do.
We do VD tests. We have classes in birth control techniques.
Mm-hmm.
We have a class in natural childbirth starting next week.
That's never appealed to me. Natural childbirth is somehow it's unnatural.
We also have a referral service for abortions.
Where's them Chumba? Chumba.
You've got to be more careful what you say to people like that.
She deserved it.
Well, I didn't. She writes one good article, and maybe I'll be able to go a day or two without every inspector in L.A. County trying to close the place down.
You just have to keep fighting them.
That is not the way I work.
That's the only way you can work.
Look, Joanne, medicine is big business in this country, and we're trying to buck it. We've got to stay cool, or they are going to kick our heads in.
I thought you were willing to take risks.
Don't tell me what I'm willing to do. Not until you're willing to come down here and put your head in the noose with mine. Are you coming back?
I don't know.
How you doing, babe?
Hi. I brought you something for good luck. What's the matter?
I think you know.
No, I don't.
Why don't you go ask my father?
Your father? What are you...
He told me all about it.
Did he tell you that I stabbed him with a needle?
I thought he stabbed you.
You're kidding. He really told you that.
You did go out with her.
I wouldn't go out with your father if he were my father. Hey, take me with you.
My father has to crew for me.
Your father, huh? Is that a rule?
That's a tradition. It's more important than a rule.
Sure it is. Until you find yourself a new tradition. Come on.
You gonna race to win?
I was racing to win when I pulled you out of the water. Please?
Come on.
You're gonna lose! After all I did for you! You're gonna lose!
After all he did for you, you're gonna lose.
After all he did for me, I almost did.
Quagren? No, never heard of it.
Well, Michelle, how are you? It's a pleasure to see you. How do you feel? Lester, would you please close the door?
Told you we mess with the wrong kind of people.
You know, I'm not really angry with you. I'm only angry with those Beach Boys. You know, I had to get rid of them. The same way, you see, as I had to get rid of you.
Old man had money coming in from all sides. All them Medicare payments to them old folks was given to him. And he was overcharging them like crazy. It's over with now. Got Floyd on the street, dealing with that shit, shooting at them people's arms. That's going too.
That man was a goddamn tycoon.
Sure he was.
What are you?
Hey, baby. I wasn't anything. I didn't even know what the stuff was until you started coming around asking questions about it. All I knew was that he had an island somewhere in Baja, had made a stash before they outlawed it. I found out what the stuff did, decided it was about time for him to retire.
So you planned on killing him all the time, right?
Not from the beginning, baby. Not till you came back. I figured that we might as well get that money and do it together, make a life for ourselves. Hey, baby, we had some good times together.
Yeah, we did.
Will you come with me? You always did like boats.
I always did like money, you know. And I always did like you. Goodbye, Lester.
Michelle? I wasn't really asking you. I'm telling you. You're coming with me.
Ready to come about?
What are you doing?
I'm pulling out of the race.
Why?
Because I've already won.
You have, huh?
Why, don't you think I'm a winner?
Sure, I think you're a winner.
Michelle. Hey, I got $250,000 of that old man's money down there. Hey, Michelle, all we gotta do is dump him out at sea. He would do it to you. Hey, look, baby, there's no point in me going any place if I can't go with you. Michelle. Hey, baby, I did it all for you. Michelle. We've been together a long time now. Come down on me because I was a joke.
You got a problem?
Are you crazy? We got a boat full of stolen money and a dead body on board.
And me.
Hey, ahoy there!
Are you okay? You guys mind giving me a ride back?
What you gonna do, leave me here by myself?
Oh, now, baby, when I do that, as soon as I get back, I'm gonna call the Coast Guard to come out and rescue you, okay? Of course, now, it might take a couple of hours to get to a phone, but I think we can deal with it. Bye, baby.
Michelle?
We have the pathologist's report that the patient, Mrs. Johnson, yes, Mrs. Johnson, contracted and died of septicemia as a result of a transfusion which was given her on, I don't know what the date is. May we have the first witness?
In my whole 9 years here, I have not seen as many infractions of the established procedures as this young lady committed single-handed.
Just what she needs.
Is someone talking? This is a hearing. Continue, Nurse Dockett.
When nurses don't follow the rules, the hospital suffers.
And when nurses do follow the rules, the patients suffer.
Everyone has their duties to perform. And if everyone performs their own duties, the hospital will be better off.
The important thing, then, is for the hospital to run smoothly.
An efficient hospital is a healthy hospital. My concern is with the hospital, not with the individual patient.
One of the charges brought against me is that I treated a man for insulin shock without a doctor's approval. Dr. Krebs, did I try to reach you for permission?
Yes, you did.
That man would have been dead if I had waited for you. Now, I'd rather lose a job than lose a patient. About the cross match.
I think there's some testimony that needs to be heard here. What are you doing? I'm saving your ass. Our friend the nurse here was dragged into this tribunal for one thing, ordering an unauthorized blood cross match. Yes?
Among others.
Well, let's just say that was one of the final straws, okay? How many cases of septicemia in this hospital since this nurse has been relieved of her duties?
4.
Well, then it couldn't have been the procedure at all. It had to be the blood.
We ran tests on it. The whole shipment was infected. We get blood from all over. There's no way of knowing if some wino on Skid Row walks into a blood bank with any number of imperfections in his blood.
Why didn't anyone say anything about this beforehand?
I was asked not to. I was told there could be a lot of lawsuits.
Who asked you not to?
I'd rather not say.
You tried to cover up what you did by pinning all this on me.
Well, the board has deliberated and we've reached a decision. Under the circumstances, we feel that you cannot be held responsible for the death of the woman. We are not pleased with your methods, but we've decided to be lenient, and we're putting you on probation for 6 months.
It doesn't matter.
I beg your pardon?
Thank you for the vote of confidence. But I have another job. When you get around to treating your nurses like human beings and your patients like people, then you give me a call. I still don't understand why you didn't tell me before. Anyway, I'm a free woman.
How free?
You still make house calls? I might need a doctor tonight.
That's one call I'll make free.
Free? Free.
Can you help this man? He's as blue as he can be. Fever's up and his hope is down. He needs your sympathy. The doctor says it's hopeless. He doubts if he'll pull through. Here's your chance just to prove what you can.